Hello, I am Meredith Borak, Patient Care Manager for Rescue Care and Resiliency at the University of Chicago Medical Center, and author for the journal Every Second Counts, Innovations to Increase Timely Defibrillation Rates.
Hello, I'm Marian Stokas, Clinical Nurse Educator for the Center for Nursing Professional Practice and Research at the University of Chicago Medical Center, and co-author for this journal. We would like to share with you our success story on the collaborative effort between Quality Improvement, Nursing Professional Practice, and the Simulation Center to improve utilization of an AED for cardiac arrest events prior to the emergency response team's arrival.
Our journey began in July of 2011 when I was hired as the resuscitation quality consultant to address the issues around early rescue and timely defibrillation of patients in cardiac arrest. Through data collection and analysis, I determined that the average response time for our hospital's code team was 3 minutes, and the number of cardiac arrests occurring outside of the intensive care unit in medical surgical areas had steadily increased. In addition, there was a decrease in the application of the AED on the medical surgical units prior to the code team's arrival. Cardiac arrest is typically associated with poor survival. An organized resuscitation effort that includes early CPR and early defibrillation can in fact improve patient outcomes after cardiac arrest. A crucial step, time to first shock, is critically important to improve survival from lethal rhythms such as ventricular fibrillation. Guidelines call for defibrillation within 2 minutes. Defibrillation after more than 2 minutes is associated with significantly low survival to discharge rates.
Acting on the data Meredith was able to collect, we decided that medical surgical nursing competencies scheduled for January of 2012 would be the perfect setting to address this issue. With assistance from the Simulation Center, Meredith, and Nursing Professional Practice, we developed an innovative approach to competencies. Our educational design included a 20-minute didactic presentation regarding unit-specific statistics on cardiac arrest events over the last 3 years. The education provided also reinforced basic life support standards related to compression's rate and depth. We ended the session with a demonstration on the use of AED with emphasis on the need to defibrillate within 2 minutes. We then had each nurse participate in a patient scenario with a high-fidelity mannequin. The resuscitation nurse and nurse educators played roles as family members calling for help from a patient room. The RN's response time from recognition of the emergency to actual defibrillation in AED mode was measured. Successful completion was determined if all the above tasks were performed in under 2 minutes. 123 groups consisting of 2 to 3 med-surg staff nurses and managers completed the simulation event. 35% of the groups required remediation and repeated the simulation once, with successful completion of the necessary tasks in the 2-minute time frame. Evaluations collected indicated that 93% of the staff felt they learned a great extent from the simulation.
The utilization of the defibrillator by medical surgical nurses prior to the code team's arrival has significantly increased. As you can see from the graph, of the cardiac arrests that occurred in medical surgical areas in 2011, resuscitation care was in progress upon the team's arrival in only 15% of the cases. In 2012, this rate increased to 60%, and in 2013, up to 76%. This represents a 61% improvement in AED utilization by nurse first responders during cardiac arrest events in medical surgical areas from 2011 to 2013. In addition, return to spontaneous circulation rates for medical surgical cardiac arrests climbed from 70% in 2011 to 83% in 2013. Survival to discharge rates also increased from 15% in 2011 to 27% in 2013.
After completion of our competency sessions, AED mode was used by the nursing staff on an oncology unit with successful delivery of a shock for a pulseless patient in ventricular fibrillation, with immediate return of spontaneous circulation and baseline neurological function. The patient was discharged home approximately 2 weeks after the cardiac arrest event. This is just one of the many exemplary outcomes we have had with cardiac arrest patients on medical surgical units due to the RN's newly polished first responder skills. The purpose of our initiative was to improve nurse first responders' performance on the life-saving steps required for an in-hospital cardiac arrest victim on medical surgical units. The significant increase in early AED use is particularly important as a process measurement for the effectiveness of our nursing-focused interventions.
We improved nurse first responder AED use prior to the code team's arrival by 61%, successfully addressing a critical step in the chain of survival for in-hospital cardiac arrest. We strongly believe this approach can serve as a model for other institutions challenged to improve early defibrillation rates. Thank you.